Hi all, it's Ritika. As we all know that July is the Sarcoma Awareness Month, which aims to create an understanding about sarcomas, which are the rare type of cancer that originates in the connective tissues of the body such as the nerves, bones and muscles. Sarcomas can affect individuals of all age groups including the children and adults. Unfortunately, sarcomas faces major challenges in the diagnosis, management, treatment and research. So let's find out what makes sarcoma so challenging and what are the ways through which we can overcome this problem. Some of the major challenges are late diagnosis. Sarcomas often have non-specific symptoms in their early stages, leading to delayed diagnosis. By the time they are diagnosed, the tumors might have grown substantially or spread to other parts of the body, reducing the chances of successful treatment and cure. Limited treatment options. The standard treatment for many soft tissue and bone sarcomas include surgery, radiation therapy, and chemotherapy. While these approaches can be effective in certain cases, they may not always provide satisfactory outcomes, especially for advanced cases. Additionally, the harsh side effects of chemotherapy and radiation can significantly impact the patient's quality of life. Limited research funding. As rare disease, soft tissue and bone sarcomas often receive less research fundings as compared to more prevalent cancers such as breast cancer, lung cancer, and cervical cancer. The lack of resources can slow down progress in understanding the underlying biology of these sarcomas and hinder the development of new therapeutic avenues. Lack of biomarkers. Identify reliable biomarkers for specific sarcoma subtypes is important for accurate diagnosis, prognosis, and targeted therapy selection. However, in many cases, such biomarkers are yet to be discovered or validated, limiting the ability to personalize treatments for individual patients. Sarcomas are rare and heterogeneous. Soft tissue sarcomas and bone sarcomas are relatively uncommon, making up a small percentage of all cancer cases, which make it challenging to conduct large-scale clinical trials and gather sufficient data to develop effective therapies. Both types of sarcomas have numerous subtypes, each with its unique characteristics, molecular profile, and response to treatment, which complicates the development of targeted therapies. To address these challenges and find new therapeutic avenues, several strategies can be employed, such as advancing personalized treatment, tailoring treatments to the individual characteristics of each patient and their specific tumor can be crucial. Precision medicine approaches such as genomic profiling can identify potential actionable targets and improve treatment outcomes. Through immunotherapy, exploring the role of immunotherapy in soft tissue sarcoma treatment is an active area of research. Immune checkpoint inhibitors and other immunotherapy holds promise in stimulating the immune system to recognize and attack sarcoma cells. By focusing more on clinical trials and collaborative efforts, conducting well-designed clinical trials including basket trials that group patients based on specific genomic alterations rather than tumor type, it may help identify effective therapies and accelerate progress in sarcoma treatment. And lastly, by increasing funding and support for sarcoma research are essential to encourage investigators to explore novel therapeutic approaches and would help in the better understanding of the biology of these tumors. Addressing these challenges requires a multidisciplinary approach involving researchers, clinicians, and pharmaceutical companies. Collaborative efforts to share data, promote research, and innovative treatment options such as immunotherapies, targeted therapies, and gene therapies are essential in advancing the field and improving outcomes for patients with soft tissue and bone sarcomas. Additionally, increasing awareness and advocacy for sarcomas can help generate more support for research and access to resources.